I'm Brittany with Birth It Forward, certified birth and bereavement doula, certified yoga instructor, and family photographer.
Hi, I'm Kristen Mason. I'm also with Birth It Forward. I am a certified birth, postpartum, and bereavement doula, a childbirth educator, and a student midwife. And today we are going to be doing a series on induction. Don't forget to like and subscribe so you never miss an episode. And let's get ready to hear from some doulas who know squat.
Welcome back. Now we are going to talk about induction for labor stalls. You can have labor stalls at a couple different points in your labor, and it's totally natural. So let's talk about it.
So the most common places that we see stalls in labor, which is really just a pausing of contractions or a spacing of them, is going to be at 5 centimeters and it's going to be at 7 to 8 centimeters. And there's actually very good reason for this and actually a number of them. So let's talk about the 5 centimeter stall for a second. A lot of the times when we see the 5 centimeter stall, it is the body shifting from that early labor into more of an active labor pattern. So we're hanging out at 5 centimeters and not quite being willing to get up to that 6. And that is totally fine. I often see,
Transition.
yes, when people are pausing here, baby's not in a great position.
Yes.
A lot of times. And what your contractions are doing is they're less dilating the cervix and they're trying to push the baby into a more optimal space. A lot of times, this is when babies are being moved from having their back on the side to being pushed to where their back is more on the front of your belly, which is going to help them come down into your cervix a bit better. It's trying to get them to turn their head in the direction that they're wanting. It's trying to bring the baby down further into your pelvis. There's a lot more baby movement happening here than there necessarily is dilation happening, which is totally fine and a really good reason to do a lot of position specific movements, right? And we have fantastic videos on that we'll have linked below if you want to jump in and check those out. But this is where having already done your yoga and your stretches and things of that nature is going to come in super, super handy. But another one is that maybe your early labor was pretty long and your body is going, now's a great time to take a nap.
Yeah,
You're kind of
because we're
breaking
about to
the
get needed.
marathon of birth up. So if you stall at this point and you've been stretching nice and good and they're finding heart tones pretty centrally, it seems like everything's going well and then suddenly slows down, might be a really great time to go to bed.
Take a nap.
Have a nice big meal. There's a nice pause happening. Fill yourself with some protein.
Yes,
It's I
absolutely.
This can be an absolute gift. And especially if we try to view it that way instead of a delay or a stall or as a bad thing that we need to punch through with medication and forcing the body to go back into labor, we can kind of just respect it as the break and the gift that it is to have a break, as long as mom and baby's vitals are looking good. It's gonna, always, for everything that we say here that is respecting the break kind of suggestions that might be good for you to consider, always keeping in mind that if there's an emergent situation, like, it's always nuanced. 7 to 8 centimeters. Do you want to know a kind of funny thing about 7 to 8 centimeters?
Shoot,
When you're
go for it.
checking 7 to 8 centimeters, the position of your hand changes. So you go from checking like this to measuring how much cervix is left. I can only get my fingers so far apart. This is a 7,
Yeah.
right? So when I'm checking someone's
Just
cervix,
thinking
if
that
I'm
you
at
can't
the
get it far
full
apart.
piece, that's as far as it goes, right? So
Yep.
we're at this point. So then what I'm going to do is I'm going to check and see how much cervix is left. It's a percentage guess.
Yeah.
It is not how far apart can I get my fingers. All of it's a guess.
All of it's a guess. Yeah.
But the measuring from a
subjective.
7 to a 10 is the least accurate of the measurements.
Yeah.
And therefore, you see stalls where people are saying, it doesn't seem to have changed. You're checking differently. This is also another point where we're seeing a transition from one general labor pattern to another. of active labor to this transition period where we're getting ready to start pushing that starts at around 8 centimeters. So that's another place where we can do exactly what I was talking about, where we're pausing, where the uterus needs a break. Maybe you sleep, maybe it's been a long time since you've had something to eat. Always take advantage of those breaks with food if it's safe to do so. But if
Absolutely.
you're not on Pitocin, if you don't have an epidural, feed yourself.
Indeed. Your body needs that energy in order to continue doing that work.
Mm-hmm.
Even marathon runners, true marathon runners will snack. They have food stations set up because you're going 23 miles. Well, labor is the same thing. We are doing a full-blown marathon, if not longer. Marathons can take a full day to go through. Birth can take multiple days.
Yeah.
Feed yourself.
Yep. My
Humans
dad's an
need
ultra marathon
sustenance.
runner, and you best believe he eats while he's out there.
Oh, yeah. Humans need that sustenance to continue on. After
Mm-hmm.
3 days, we become weak and delirious. So imagine what that looks like in labor if you're weak and delirious because you haven't eaten. That is not a good thing.
Right.
Eat something.
Drink some bone broth at the very least.
Oh, yeah. Bone broth is great. Yogurt is
Honey.
a great option. Cheese. We got a whole bit. Well, I've got videos
We've
on
got
that.
so
So
many videos on that.
yeah, go watch those
Go
videos
watch those.
and eat. Feed yourself.
Mm-hmm.
Feed your body. Feed your
Mm-hmm.
baby. Your baby needs the
Yeah.
food just as much as you do.
Mm-hmm. Yeah, I like to encourage people to really see these quote unquote stalls
Yeah,
as God's gift to us as breaks. Take a
absolutely.
nap. Take an opportunity to feed yourself.
Yes, we have seen countless births have this delay at 7 to 8, or even and the 5 centimeter one have these delays. And it's not that it's a delay; it's your body saying, "I need a break. I need some rest." Go
Mm-hmm.
take advantage of that break that your body is clearly telling you that it needs. It needs
Mm-hmm.
something from you. Eat, take a
Mm-hmm.
nap, drink, and then you know what? You're gonna have a baby in a few hours after, most likely.
If you've got a larger pelvis, if your baby has that's always, I remember when I first started as a student and I was taking a newborn exam recording, and they said 14 centimeter head. And I said, how did a 14 centimeter head fit through a 10 centimeter cervix?
Because they
And
expand.
my teacher laughed and she goes, because the mother dilated to 14 centimeters, not 10.
Yeah.
And do you know where that change is lost in measurement? 7 to 8 centimeters, because that's when I'm changing to a percentage. So a lot of times if you're stalled at that 7 to 8, you're not. You're
No,
making
you're not.
cervical change. It's just not being measured. So something to keep in mind.
Well, the shoulders, the baby's shoulders are wider than the baby's head. So take with that what you will. Take from that as well.
Yeah,
You always
you've
see
got,
those babies come up. They smoosh
yeah.
in, but they're still not going to smoosh in enough that,
Mm-hmm.
I mean, our shoulders widen out as we get bigger, but
Yes.
you know,
Well, when you're doing the newborn exam, the chest itself tends to be pretty similar to the head. And so then you're keeping in mind that you've got the arms and you're dilating more than 10 centimeters.
absolutely more
And
than
most of that difference, we're not saying we need to get to 15 centimeters or something, because not every baby's got a 14 centimeter head. Some of them
no,
are 13. There's a large variety in baby size. There's also a
there is.
large variety in dilation. So if you're saying, ladies, I hear you saying that I'm going to stall and that I'm going to take a nap, but do you not remember that I'm in transition and I'm having a contraction every 2 minutes? There is no nap. There is no eat. What are you talking about? Well, if that's the case, if you're not experiencing a stall in the sense of contractions, you're only experiencing, which some people have, and that's normal and what we were just talking about, but you're experiencing only a stall in dilation, then that also might be the case, that you're not actually stalling in dilation, that there's just an error in measurement that even the best measurer is going to struggle with at that point, because you need to dilate more than 10 centimeters.
You do, yeah.
10 actually means
And then each
100%.
person, yes. And then and we don't know where 100% is per person. We really
Right.
don't. There's
Yeah, you
always
just feel
something
that it's
left.
gone. You say,
Yeah.
okay, when I put my hand in here, I don't feel the band anymore. And I feel baby's head and it's right there. Then that is when we start saying the 10, it's complete. It's 100%. It's not actually 10 centimeters.
Yeah, it's just gone. That's all there is to it. Yeah, but everybody is different in that way. So what can we do other than rest and food during this delay, during the stall that we call a stall? Um, you have the option of breaking your water if that hasn't been done yet.
Mhm.
Um, possibly if it hasn't been done, your body is going to break the water on its own. But you can absolutely have your baby in call in the water sack. It doesn't have to be broken for you to have your baby.
Mermaid babies.
They're awesome.
They're pretty cute. I mean, all babies are cute, but it's pretty cool to watch them come out still in the sack,
That'd
especially
be
in the
so,
water because the sack tends to stay intact better.
yeah.
Um,
You got to go to one that was supposed to be my in-call birth, and I didn't get to.
My very first one, I have no idea how many in-call births I've been to at this point, but my very first one, yes, I was your backup. And I
I
was
know,
so blessed that I was able to go. I'm so
and
sorry.
I didn't get to go. That's okay. I will hopefully have another opportunity at some point.
You haven't seen one yet?
No,
I'm so sorry. I'll stop bragging about being to them then. They
they're
happen at
so
home a
cool.
lot more than they
Yeah.
happen in the hospital because at home, you have to convince us to
Yeah.
break your water. We look at the potential side effects of having your water broken very seriously and just kind of as a natural practice respect the body doing things on its own and breaking the water. It can cause a baby to come into the cervix with a wonky head with the hand up. It can cause cord prolapse. It can nick a blood vessel and cause baby to bleed. I mean, there are things that can happen that we just most of the time don't consider it worth it. Especially because it's not guaranteed to actually help anything. Sometimes water gets broken and the water broke and
I
that's
see it.
nothing.
I know.
But
I've seen
sometimes
it
it
many
can.
times.
Yeah,
Yeah.
sometimes it is the right choice. I was just at a birth this weekend where breaking the water ended up being the thing that helped move us forward.
Mhm.
But it took hours for us to decide that we were comfortable with that decision. That was a lot of movement and a lot of things that we did to try and make sure the baby was going to come down in a good position. Because then you're wondering, why is the water not breaking? Once this water is broken, the baby's position is pretty well fixed. And is it not breaking because the baby's not in a good position? So the contractions, instead of going straight down the abdomen and then hitting the cervix, is being dispersed strangely. And that's a good thing to push baby where they need to be.
Mhm.
Um, things like that. I'm sorry, I could talk about water breaking for
An
hours,
hour.
probably multiple
Yes.
hours.
Yes.
Yes, because I'm used to talking to clients about it for hours to really explain to them the different options and why they might decide to do one thing or another. But this is, if your water is still intact at this point, especially if you experience a stall, it is very common for it to be suggested as an option for hospital induction.
Especially in a hospital situation.
Mhm.
And that doesn't make it right or wrong.
Mhm.
It's your choice in where you want to go with it. Just taking in mind the risks and why you might be having this stall. Um, otherwise, work on your positions. Work on how you're sitting, how you're laying, where your legs are, in
Yeah.
where your pelvis is.
Mhm.
Just
Yeah.
ultimately take that break. That's the biggest thing that we can say in this particular moment
Yeah.
of
Bring that
time.
baby down. This
Hmm.
is also a very common time for people to get epidurals.
It is, yeah,
Mhm.
because it gets intense, but that's part of why the stall happens, I think.
Mhm.
You know, it gets that intensity because you're building up into that 7, 8 intensity from the 6, because we had a big change from 5 to 6. Now it's really intense. We're having a hard time. managing it, and then you don't notice you're stalling out, so you go and get that epidural in order to help you manage it, and then all of a sudden, now we're stalled. And now's when you're going to get that break to get your sleep, get your food. But you can't get food now that you have the epidural because we have some other risk factors involved. So, I
For
mean, had we
most,
waited a little bit, we might have noticed the stall.
mhm. Yeah, most practitioners are not going to be comfortable with you eating once you've had an epidural. And I always say that you are your own autonomous adult human being, but if you do decide to eat, don't lie to your providers, don't hide it from them. Please let them know. It's important that they
Yeah.
know if those risk factors do come up and you do end up in a C-section. It is important that they know that there's food in your belly. But that
I like
they
to say,
cannot
ask for
stop you from
permission, but
eating if you
don't lie.
want to.
Yeah,
Mhm.
they can't
Yeah,
stop.
even just inform them. Even if you're not asking permission, you just say, hey, I am incredibly hungry. I am not going to be going any longer with food. I accept the risk that comes with eating, but I need to eat. But I want to let you know that I am making that decision. And that can be very uncomfortable, and you can be met with pushback for that, but they can't keep you from eating,
Mm-mm.
especially now that
Or
you can DoorDash.
if you're like me and you have a hard time saying things like that to people, just eat and tell them, yes, I ate.
Do it
You know?
and then tell them.
Yeah,
I always like to say, to keep your birth team as your team and let them know what you're doing.
yeah. I mean, hopefully you'll have a doula in the room, and your doula will encourage you to eat. And you don't have to ask for that permission from, I mean, the doula is not here to give you permission or not. The doula is
Oh.
here to give you education and to help support you through your experience.
Mm.
Eat. And then when the doctor comes in or the nurse comes in and says something and asks, oh, did you eat? Yes, I did. Thank you.
Well, that makes you uncomfortable, then don't. That's fine.
Yeah,
That's
then
also a
don't eat.
decision that you can make.
Absolutely. Absolutely. I am a big fan of making sure your body is nourished for the hard work that it's going to do, that it is doing. It is expending an incredible amount of energy, and that you can't replace without some form of calories going into your body,
Mm.
even if it's just a
Yes.
smoothie or broth.
Hmm. Yeah. Bone broth, honey, those are my favorite. But my
I like the
absolute favorite
smoothie.
is meat. I like my
Meat,
clients to eat meat.
yes, I like meat. Or if they're not hungry per se, one of my favorite things is a protein shake, a protein smoothie of some kind.
Yes, protein shakes, bone broth
Yeah,
smoothies. Anyway,
yeah.
we have other videos on that.
We're on off topic again.
I'm not off topic. We're just going more into what to expect, which is
Yes,
what does the situation sometimes look like.
yes.
So for some people, getting an epidural at this point is what they need to help them get sleep.
Mhm.
And if you've been with us since the beginning, we started this induction from nothing. We've been here for days, haven't gotten good sleep in a hot minute, and we're getting concerned that you're not going to get to the finish line. Then sometimes an epidural is the right decision for that family, but it's completely up to you, and your practitioner of what's a good idea. What to expect if that does happen. You're only going to be able to have one support person in the room. Most hospitals want even your doula, if you choose for someone else to be your support person during that, to leave, and only one person. And you're gonna lean over them and open up your spine, look down, and they insert the needle, and then they want you to lay flat. The contractions are still able to be felt. You start to get some relief generally around 5 minutes after you have gotten this initial dose. And you need to lay flat on your back for that. So that is an expectation to kind of set beforehand.
The epidural works through gravity. So by laying flat, you're allowing gravity to make sure that medicine is balanced. If you're not flat, then we have unbalanced medicine, And now you're feeling that relief on one side more than you are on the other side. So lay flat, letting it take effect.
Yep, absolutely. Something else that might happen during this time is your blood pressure more than likely is going to go down. So if you already have low blood pressure, then that's something to take into consideration. If you have high blood pressure, this can be a nice option to kind of help lower it a little bit. Um, in response to that change of cabin pressure, babies' heart rates can sometimes be affected. And so sometimes we see babies really not like the epidural. So the monitoring that's going to need to happen is going to be quite high. And you're going to want to have quite a few people in there to be able to move you because your movement isn't going to be as readily available to you. And to be able to try and see if movement can help get babies' heart rate stabled. So I always say if your doula does need to leave the room, it can be quite helpful to have them stay just on the other side of the door because they can be a very helpful person to help move you into
I've,
those different positions.
I have found that it's not generally hospital based, it's more provider based. It's more based on the anesthesiologist and their comfortability with having multiple people in the room. Um, Many of them have been fine with me sitting totally to the side, not moving, just sitting. So you can ask them, I would like my doula to stay in the room and
Mhm.
just have her sit over there. She knows, or he knows, not to move and to just stay totally still while this happens. Sometimes they just don't want them behind. They don't want
Don't
someone
want anybody
behind.
looking.
Yes,
Yeah.
it's performance anxiety, just
Who
like in
wants
any
performance
other,
anxiety when they're poking somebody in the spine?
right? And something else to think about with the epidural is it's not just one needle. What you're doing is you're going to have a few pricks along the site where they're going to insert the epidural. So that is what's going to hurt the most. You're going to get that Novocaine style. I don't remember what they use, but you're going to get
Lidocaine.
that initial,
It's
yeah,
lidocaine.
um, lidocaine. You're
Mhm.
going to get the lidocaine. So that numbing agent, the local anesthetic, before they do the larger needle into the spinal column for the epidural medication. So,
So you don't feel the big needle, just four, we call them little pricks, little bee stings.
yep. But I've heard different people have the different tolerance for them. So, I mean, some people really, you really don't want to bounce. You don't want to jolt or anything when it
Yes.
happens.
Be still.
Um, yeah, be still. And then the epidural, I hear, is more of a pressure that they're putting in because it's pretty large and it's a pressure that's going in. It's not really a pain so much as pressure,
Yeah,
and it
it
can
should
feel
be.
pretty intense.
Mhm.
Yeah,
Yes. If it hurts, please tell someone. We don't
yes,
want
let them
them
know.
to poke a
They'll give
nerve
you more lidocaine.
or adjust where they're
um,
poking you.
yeah, or adjust it. So, and the whole experience can take anywhere from 15 to 30 minutes. I have seen some take up to 45 minutes. Just depending on maybe they're having a difficulty getting the right spacing just
Mhm.
because of the body type, for whatever reason. So I've seen them take longer and I've seen them go really fast. It just depends.
It does. Yeah. And the skill of the person who's doing it.
Yep.
Keep in mind, if you're at a teaching hospital, then there's a good chance that a student, also known as a resident, is doing your epidural. If you're comfortable with that, you might also go ahead and request that their instructor is there just in case they are having a difficult time. I have attended a number of births where the student themselves was not, the instructor was not in the room. And then after a few attempts at an epidural, they wanted the instructor to come help because they were just not hitting the right place. And then we had to wait for the instructor, which is extremely uncomfortable for a person who is already asking for relief. So you can save some time by having the instructor already be in the room. And so then if they have a difficult time, then they can step in and there's not that 20, 30, 35-minute wait for
Absolutely.
for the instructor to free up whatever they're doing to be able to come to you.
Yeah. And then something else to think about is the epidural can take up to an hour for full relief to take place. Um, so you're going to be mostly on your back for that entire duration. We can rotate side to side after 30 to 40 minutes, but for the most part, you're going to be on your back as we allow that medicine to really saturate the area that it needs to saturate.
Yeah. Okay. So I think that about covers all of the things that I was wanting to discuss for these stalls. Did you have anything you wanted to add?
No, I think we got through everything. Especially, I mean, we went and made a list beforehand. We went just da 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 da.
Checked it all off. Okay, excellent.
We did.
Okay, so that's it for all of the hospital labor induction methods that we were going to discuss. Join us for our next video for our home birth induction methods.
Yeah. We'll see you again soon.